All right, so we talked about fetal heart rate as if it's a constant rate. Um, but if you notice, the line that traces the fetal heart rate was very squiggly. So let's go and look at what that looks like real quickly. See, this line is not just always the same rate, it alters. Really from beat to beat, it changes. That's what we really want to see, okay? That variability indicates how the fetus is tolerating labor. It indicates if the fetus is being oxygenated adequately. It can indicate neurologic status. It's not a perfect indicator of that, but if there are some changes in it that we may see with certain neurologic problems. So we call that changing the squiggly line, we call that variability. Those are minor fluctuations in the fetal heart rate baseline. And we're going to start with what we want to see. In your notes or in my notes, the different designations are in order from least variability to greatest, but we're going to start with what we want to see. So we want to see moderate variability, and that means that the range is 6 to 25 beats per minute. It's considered a reassuring sign. Usually we're going to see pretty good variability, pretty moderate variability early in labor. We may see that variability decrease through labor somewhat. Even if it stays within the moderate range, it may just appear to settle down some as labor progresses, because labor is a stressor on the fetus. So we're going to look back at this screen, and this is this strip, and we're going to see what the variability looks like here. So it looks like this is ranging between about 130 and 150. That's about a 20 beat range, which would mean it is moderate variability. Okay, so just as a quick test or a quick review, what is the fetal heart rate baseline on this strip? Okay, the fetal heart rate baseline is 140 with moderate variability. So now we've added something in. We went through how we're going to designate all the contraction stuff. Now we've added something in on the fetal heart rate. So that's moderate variability. It is considered a reassuring sign. That's what we want to see. So the next thing I'm going to look at is marked, because sometimes if the fetus gets stressed, you'll see a much greater amount of variability. They're still accommodating for the stress, but it's taking more to accommodate. So let's look at marked variability. Marked variability is greater than 25 beats per minute range. So you see this one's kind of all over the place. And we're going to talk about these dips later on. We're going to talk about what that looks like later on. But this marked variability from beat to beat, this big changes indicate some stress typically. Now, we may also see marked variability if the fetus is very excited, if they if they're startled, we might see a little bit of marked variability. Where we see it frequently, though, is someone who has received a beta adrenergic agonist, usually for treatment of preterm labor, because that makes one of the side effects of those meds is jittery, increased heart rate. That happens with the fetus. So we'll see an increased heart rate, but we may also see increased variability that reflects that jitteriness. Marked variability is something that we want to note. If it continues for a long time, we're going to notice that, that fetus has been stressed for a while. It's not necessarily a danger sign. We do want to watch, because if the fetus is having to accommodate that much all the time, they're going to get tired. Okay, so let's look at the next variation. What if instead of being more variability, we have less? This is what's noted as minimal variability. Minimal is the range is there is fluctuation, but the range is less than 6 beats per minute. And it's very hard to see. Some resources will say less than 10, but this looks like it's fluctuating between like 45 and 50 most of the time. So this is very little fluctuation. So this would be noted as minimal variability. Now, minimal variability can indicate that the placenta is not getting adequate oxygen. Okay. It can indicate that the fetus is sedated. If we give that mom some pain meds in labor, especially if we're giving an IV opiate, we're going to see decreased variability. So we're probably going to be documenting minimal variability after that. We know the cause, so we're not necessarily stressed about it. We just observe it. You're going to see decreased variability sometimes if the fetus has tachycardia. So if the heart rate's higher, they may have less variability. That's an indicator of stress. Okay. We may see decreased variability in premature infants and a premature fetus. There are some congenital anomalies that show decreased variability consistently, and then sometimes there's a neurologic injury that may cause the variability to be decreased. But we also might see that decreased variability just when the fetus is sleeping. So if you have a period of decreased variability, we usually want to watch it for about 30 minutes. Fetal sleep cycles are typically 20 minutes. So, and you can actually look at the strip and we're asleep, and it's almost exactly 20 minutes nearly every time. It's right at 20 minutes, and then the variability returns. So minimal variability isn't necessarily a bad sign, but it is one of the things we look at when we're looking at the health of that fetus. So I want to show you what happens or what it looks like when the variability completely goes away. And this is considered an ominous sign. Okay. Absent variability, you can see, this is sitting right on the 150 line. If it's changing, it's like 149 to 151, that's it. This is absent variability. And it usually indicates severe stress. You can see this if the fetus has hypoxic brain damage. But that absent variability indicates that that baby needs to come out usually. There is no detectable fluctuation. So that's what the difference is between absent and minimal. With minimal, you can see fluctuation. It's less than 6 beats per minute. With absent, you cannot detect a fluctuation. You saw how that line was just pretty much straight across on the 150. And that's not considered a reassuring sign. Okay, so we've talked about the variability a little bit. I want to talk about a baseline pattern that sometimes we mistake for variability. I'm gonna have to. There's a baseline pattern called sinusoidal. And it's when the fetal heart rate baseline does vary, but it's a really even fluctuation. Okay. This looks it's a very even pattern. It's just a regular smooth wave. This is also not considered a very reassuring sign. And it's not variability. Don't mistake this for variability. This can be a sign of fetal anemia, infection. Sometimes you see this with opioids. You may also see it with fetal neurologic damage. So make sure that we're not mistaking this for variability. Okay, so we've talked about variability. In the next section, we're going to talk about some changes in the fetal heart rate. So we're going to talk about accelerations first.